This is my audience. My name is Brittany Pfennig and I'm giving my informative speech on OCD. Have you ever caught yourself doing repetitive behaviors like checking and rechecking a locked door? Or flipping the light switch on and off, and on and off? Or have you ever noticed that one thing is out of place in your home that you cannot carry on with your daily life? If you have answered yes to any of these questions, then you may be experiencing obsessive-compulsive disorder-like symptoms. Now, I'm no doctor, so I'm not necessarily saying that you have OCD, but I am saying that you might want to consider meeting with your primary doctor if you have any concerns. Even though I'm not a doctor, I have been living with OCD for 15 years. While my obsessions are only mild to moderate, there are others who experience a greater impact on their daily life as a result of this disorder. Nancy Pfennig, registered nurse at MedCenter 1, stated during a personal interview on June 26, 2012, that OCD can occur in different types and at various degrees based on each situation. Today I'm going to explain the different types of OCD, treatment options for OCD, and my real-life personal experiences dealing with OCD. According to the American Psychiatric Association's Diagnostic Statistical Manual of Mental Disorders, there are 5 distinct types of OCD. The first common type of OCD is contamination obsessions, with washing and cleaning compulsions. People who wash and/or clean excessively or feel distress associated with contamination may be experiencing this first type of OCD. Harm obsessions with checking compulsions is another type of OCD. These people have intense thoughts about harming themselves or others and use checking rituals to relieve this distress. The third type of OCD is obsessions with symmetry regarding rearranging, ordering, and counting compulsions. These people feel that they must arrange and rearrange items until those items are just right. And this may go on for seconds, minutes, or in extreme cases, even days. According to an article titled, "A Critical Evaluation of OCD Subtypes, Symptoms versus Mechanisms," another type of OCD is called obsessions without visible compulsions. People who experience unwanted obsessions, such as intrusive thoughts regarding aggressive religious or sexual themes, may be experiencing this type of OCD. The last distinct type of OCD is known as hoarding. According to an article titled "Pathological Hoarding," Jeffries and Moore stated that people who collect items that are adjudged to be of little value by others and who allow these items to overtake their living space are experiencing symptoms of hoarding. Now, if you think that any of these 5 types of OCD relate to you and your daily life, don't be distraught. Even though there is not a cure for OCD, there is help that is available. There are treatment options available to people who have a difficult time continuing on in their daily life as a result of their OCD. According to Mayo Clinic staff via mayoclinic.com, there are 2 main treatment options for OCD: psychotherapy and medication. In cases where psychotherapy is used, the individual may be exposed to the obsession and/or the compulsion and given ways to deal with the anxiety experienced at that time. In other moderate to severe cases of OCD, antidepressant medications such as Prozac, Zoloft, or Praxil may be used to increase the patient's serotonin levels, which may be low when a person has OCD. I personally have not been prescribed an antidepressant to help with my OCD, but I have sought the help of the psychologist to learn of ways to help control my obsessions. My personal experiences living with OCD are quite unique, to say the least. As I previously stated, I was diagnosed with mild to moderate OCD symptoms. My obsessions don't significantly disrupt my daily life, but they do cause me some anxiety from time to time. Because of this, I have been prescribed a low-dose anxiety medication, and I have noticed that it helps alleviate my anxiety caused by my OCD. The main type of OCD that I experience every day is my obsession with symmetry regarding arranging and ordering. For example, everything in my apartment has its place. The keys go in the wicker basket, the large glasses always go to the left of the small drinking glasses, and no 2 colors of pillows on my sectional sofa can be next to each other. If something is out of place, I cannot continue on with my daily life until I place it where it belongs. The other type of OCD that I experience daily is my obsession with cleaning. When I come home from work, I go into extreme cleaning mode. I'll place dirty dishes in the dishwasher, wipe off the kitchen counters, and throw away any cans, bottles, or wrappers that have been left out. It's nearly impossible for me to relax until my home is mess-free and clean. And overall, I've realized that as a result of my OCD, I just carry on with it, and my rituals are just normal. I am still able to function just fine in my daily life. Remember, obsessive-compulsive disorder can occur in 5 different types, at various degrees based on each individual's situation. Today I explained the different types of OCD, treatment options for OCD, and my personal experiences dealing with OCD. And if you believe that you are struggling with your OCD, I wholeheartedly ask you to speak to your physician about your concerns. You should not be controlled by your obsessions. Your obsessions should be controlled by you. Thank you.